my name is Dave Collins, and I'm the engineering lead for 3D LifePrints, embedded 3D printing facility at Aldgate Children's Hospital in Liverpool in the UK, working with clinicians both there and the wider Merseyside region. I completed a PhD in research fellowship in computational biomechanics prior to joining 3D LifePrints, and I've gained significant experience working in medical additive manufacturing with a particular focus on paediatric surgical disciplines. So I don't think Nick is with us, so I'll carry on. So today I'm going to give a high-level overview of 3D LifePrints and the work we do before moving on to look at the key relationship between that work and medical imaging modalities and navigation systems. So a bit about us. Currently, we operate from 4 embedded point-of-care medical 3D printing hubs in key NHS hospitals, with more planned in the coming months. And from these embedded hubs, we work with a further 50 plus hospital clients and multiple research institutions across the UK and Europe. It's also important to mention that we're ISO 13485 certified and UK EU regulatory compliant from medical devices. And then looking forward, we will be opening a US headquarter in Texas later this year, and we'll be working closely with Houston Methodist over the coming months, particularly in respect to those devices which we have FDA clearance. So we're super excited to start that journey. Okay, so it's fair to say that the work we do is primarily driven by needs in the medical and surgical care of patients. We aim to meet these needs by embedding our engineers within host institutions and utilising 3D technology to develop and manufacture personalised medical devices. These personalised medical devices take many forms, but often fall into 3 categories across a range of class devices. So these are patient-specific anatomical models, patient-specific surgical guides, and patient-specific implants, all of which use patient medical imaging and anatomy as their foundations. Ultimately, they aim to aid the pre-surgical planning process, improve surgical accuracy, reduce theatre times, and ultimately improve patient outcomes. So looking at these devices in a little more detail, we'll start with our patient-specific anatomical models. These act as visual aids for the surgeons. They can better understand a patient's complex anatomy, and by printing in tissue-like materials, also offer them the opportunity to simulate surgery prior to theatre. And also additionally, by being able to print in a variety of colours as well, we can really highlight regions of particular interest. Our patient-specific guides and implants are designed to exactly fit and reflect the patient's anatomy and accurately delineate vectors for cutting and drilling. And as you can see here, it designed completely bespoke to that person's anatomy. Okay, so as we've already kind of mentioned, alluded to, we deliver these devices from our embedded hubs. What does an embedded hub look like and entail? Well, it means placing our engineers and 3D technologies, so including all the necessary software and hardware, so printing kit, segmentation software, on site to provide medical 3D printing services at the point of care. So in doing so, it's possible to provide effective solutions to clinical problems by combining our expertise in engineering and science with the medical expertise and knowledge of the hospital's clinicians. And this brings a number of benefits. It allows direct communication between the engineer and clinician, which ensures the design and manufacture of clinically valuable devices tailored to the specific needs of a case. It also means that the clinician retains full power and responsibility through a comprehensive review and approval process via our digital platform. And finally, this direct communication between the engineer, the clinician, and also the wider hospital network facilitates rapid delivery of devices and also helps to foster innovation. Clinicians can approach us with challenges they're facing in their clinical practice on a daily basis, and we can work with them to solve these challenges in a collaborative way using short iterative cycles. And obviously, while the COVID pandemic brought this dynamic to the fore, we've also worked with or are currently exploring a number of novel devices and techniques across our hubs with clinicians. So the system works really well. A presence also introduces Additional options, so options for on-site simulation benches and workshops where clinicians can simulate procedures and surgery on anatomical models prior to the theatre, and on-site controlled environments for the clean manufacture of sterilizable models and implants, which again helps rapid delivery of devices. And all this means that through an embedded hub, we not only provide the host with patient-specific products, but we also can provide a full service package. So we therefore provide a suite of products and services, including segmentation of patient data to create the patient-specific devices, design and manufacture of the patient-specific devices themselves, simulation and educational models, wider medical device design and prototyping, and a comprehensive digital platform that wraps our services end-to-end and captures invaluable data analytics. Okay, so because our core work centers around patient-specific devices, medical imaging data forms the starting point and foundations for much of our day-to-day work. Using a patient scan, we can segment out relevant anatomy, like you can see here in this picture, and create virtual models, which are then used to create our patient-specific models, guides, and implants. As such, we work across a full range of medical imaging modalities, depending on what's available or most appropriate for that particular case and anatomy. And we work with them both in isolation and in combination, the latter being something we do particularly for complex cases and devices where it's necessary to use as much information as is available to us. So we've worked on a few cases where we have combined and registered data sets. So this is a particularly complex orthopedic oncology case where we needed both the CT to define bony anatomy and then the MRI to define these tumor boundaries, so we could accurately design not only the anatomical model, but also the patient-specific cutting guides for a safe and effective removal of that tumor and to help maximize preservation of good quality bone. So outside of this core clinical work, we also use 3D tech and printing to create medical imaging phantoms and simulation models for medical training and education. So these capture complex pathologies and give medical professionals the chance to familiarize themselves with difficult conditions, procedures, and protocols. So this has included, for example, the design and manufacture of mitral valve simulators to help surgeons in robotically assisted mitral valve repair. So it's a really nice use case for these in training. In terms of our imaging phantoms, well, these are printed in tissue mimicking materials in the sense that they scan appropriately under ultrasound, MRI or CT, for example, by scanning with appropriate Hounsfield unit ranges, and by manufacturing them using 3D printing, which is a process that inherently lends itself to complexity. It becomes possible to capture and print complex pathologies. And so in this way, in combining both of these things, these 3D printed phantoms can help inform imaging research and protocols to, for example, maximize image quality whilst minimizing radiation doses for patients with complex conditions. And as a result of this, we have a number of ongoing projects in this area, including the head phantom you can see here, which uses relevant 3D printing tissue surrogates and metalwork to optimize CT imaging in an anatomical region that is often prone to artifact due to, as you can see here, orbital floor implants or dental amalgam, and things that can really mess with the scan in an important anatomical region that you don't want exposed to needless amounts of radiation. Other projects in this area include developing scoliotic spinal phantoms with metalwork to help validate intraoperative imaging systems used during surgery, and ultrasoundable jugular access simulators to help improve image-guided clinical skill sets and techniques for clinicians working with pediatric patients with very small and often difficult to locate vessels. So that concludes the kind of whistle-stop tour of the work we do and how it aligns with Houston Methodist. But hopefully it gives you some insight into that work, and you found it interesting. So I'd just like to thank you for your time. And just if you have any questions, please feel free to field them now or to drop into our booth later to ask them. Thank you very much.